Here we
No practice necessary.
go. Dr. Olm, welcome back to the show.
Missed you. All right. So this is the no prep
This is
roll.
no prep. I think
It's better that way.
well, it's like everything on social media is like so overproduced and overplanned. It's like having a conversation or a podcast where like you haven't even talked about the question, and maybe I haven't even prepared anything. Maybe
I
I'm
don't
not
know.
even prepared. We'll never know.
We'll never know. Or we'll figure it out here soon. But
So we had the last time we recorded together, which was in this apartment that I'm
sitting in
in.
that room.
Yeah, I think I was over there on that couch that I'm looking at.
Yeah.
We were talking about the extension compression stabilization strategy that you really helped me develop my understanding of. And interestingly, so over the last, gosh, when was that? Like 2 years ago that you were here?
Oh, I bet you it was pre-COVID, dude.
I'll have to look at the timestamp of that picture of our calves next to each other that I texted you recently and see what the date was.
It was taken at
Oh,
2 in the morning in the middle of the street in Buenos Aires. Cool.
what was the blood alcohol level?
Yeah, yeah.
Um,
We were
but
walking for sure.
yeah, I've been doing a ton of running actually in my training. And in doing that, like highly repetitive motion, I realized like I was, I'm definitely, and I have been holding a lot of tension using extension in my lumbar spine, like just even walking around. And so what has happened, like through running, especially, I started to become very aware of like, oh, there's like this subtle tension that I'm kind of always holding
Mhm.
and torquing on my pelvis. And so that kind of bled over into all the rest of my training. And I realized like I am definitely holding my spine weird. Like it was like I knew it theoretically from what we had talked about and some of the other training I've had and stuff. But then I had this like, oh, I'm actually experiencing what that is. And it was way more subtle than I realized because I just was not aware of that I was in fact doing it. And so I've been sort of trying to retrain some of that myself. And and I know we had kind of talked about how we had a similar background of like low back issues, extension, and then also like some shoulder stuff. And I realized, and kind of what I want to get into with you is the way that stabilizing that way in your core and your trunk around your lumbar spine affects like how you're using your hands,
Mhm.
because I realized my entire rib cage and my scapula and my shoulder joints, because I was holding my spine that way, like if I was to press overhead, it's like, oh, I was actually pushing overhead off of a spine that was being held with extension torque essentially. And and I realized like over a long period of time, there's some really kind of messed up adaptations that can happen from that.
Well, there's a lot of. It's funny. I wrote one of the presentations for the DNS Strength Training 3 class that we did in November was the consequences of an extension compression stabilizing strategy.
Oh.
And I went through probably 20 different sequela, if you will. But with a runner,
Sequela.
isn't that nice? It's a nice little like medical term.
Oh, I gotta write that down.
It's
Sequela.
just
I
it's
haven't used
just
that one.
basically it's a side effect essentially. Um, so if you have someone that has a tight back, you're going to get neurological sort of tension or upregulation of really the entire posterior chain. So hamstrings, calves, back of the neck, all that kind of fun stuff. And depending on what you're doing, if you're someone like, in your old CrossFit days, if you're doing lots of bilateral hinging, then that's going to result in some back aggravation. Maybe it's a disc thing, maybe it's faceti, whatever. If you're running, though, you might start noticing that your Achilles starts getting a little bit more sensitive, or maybe you get some plantar fasciitis on that side. And, that phenomenon, while we talk about it and we think of it as a symmetrical sagittal plane phenomenon, it's actually asymmetrical. And if you went through and tested, you might notice that one calf is a little tighter than the other one, or if you foam roll that calf, it's more sensitive than the other side, or one Achilles tends to be a little bit tighter in the mornings. And that is all the result of a combination of one, you're stabilizing with that extension compression stabilizing strategy, which we'll define here in a second. And two, you're doing an activity that loads a part of that chain, in this case, the ankle and the foot. So I see this all the time, and it's really this like, from the core out, you get this kind of um, radiation of dysfunction because it's not just a mechanical connection. We all love to do this, like, okay, the pelvis tilts forward, it lengthens the hamstring, it pulls on this. There is a little bit of mechanical connection between those things, but really the the connection between the low back stabilizing with an extension compression stabilizing strategy and increased incidence of plantar fasciitis on that side is neurological. It's not structural. It's not mechanical connection.
Uh-huh.
But anyways, before we get too lost here,
Yeah.
for those of you that are listening for the first time or have never heard of this extension compression stabilizing strategy, this is essentially my explanation for a postural syndrome that several brilliant clinicians have just described, really going all the way back into, I think, the 1950s or 60s with Vladimir Janda, who's, of course, a famous Czech neurologist. Or actually, he's not a neurologist, he's a musculoskeletal specialist, but he's an MD over there. And his pattern that a lot of people have heard of is called lower cross syndrome. And that is essentially appreciating a common pattern wherein the hip flexors and the spinal extensors are overactive, secondary to the abdominal wall and the glutes being inhibited or weak or inactive. And for him, that was something that happened over time. So he calls that one lower cross syndrome. His protege, Pavel Kolaj, who's the founder of DNS, he actually calls a similar pattern open scissor syndrome. And this one is actually appreciating an oblique orientation of the diaphragm and the pelvic floor if you look at the sagittal plane. So from the side, if you look at it, the rib cage is elevated, the pelvis is tilted forward. And then the last guy that I know, his name is Ron Hrushka. He's the founder of Postural Restoration Institute. He has a pattern called posterior exterior chain, which is a very similar pattern as the two that I mentioned. And that's essentially where you've got a lot of tightness in that posterior chain from the hamstrings, the lats, the back. For me, just being a mechanics geek and wanting to highlight the actual internal forces affecting the spine, I call it an extension compression stabilizing strategy, really because I don't think people fully appreciate the impact that the compression has on the spine and how sort of that can cause all kinds of problems. We can talk about chronic low back pain if you want, and I think that that's a driver of it. So that's why I call it extension compression stabilizing strategy. So it's when someone uses extension and compression of the spine by way of essentially overactivity of the posterior chain
Mm-hmm.
to stabilize it. What is a little bit confusing, or at least sort of a swimming against the grain, is most of the strength training world admonishes the posterior chain and always wants to make it stronger and better, and more training of the posterior chain equals more better. But what I found a lot with the athletes with which I work and the patients and myself, who now, after 15 years of chronic low back pain, continuous low back pain for 15 years, my back's not even tight in the mornings. And it was essentially addressing this problem.
Yeah.
But I see overactivity, over dominance of that posterior chain causing postural distortion and both neurological and mechanical dysfunction in not just the spine, but the legs, the ankles, the shoulders, the wrists, the neck, whatever. And that all comes from a pathological stabilizing strategy that I call an extension compression stabilizing strategy.
Yeah. Like I think I think that term that you've coined, like in my mind, it makes a lot of like, I actually, rather than like calling it a syndrome or something, it's like that is literally, like you said, it starts in the core and it radiates out. That just if there's dysfunction in the core, then it radiates outward from there. And the extension compression is essentially the thing that's happening at that most core cause level. So, like I think about that term a lot. Dude, so something interesting I noticed about myself when doing this was like, I was, I think part of that extension force that I was using to stabilize was coming from my lats. And I think a lot of that was driven from doing a lot of deadlifts and really trying to clamp my lats down. And so one of the things I realized, because it was like I was having some stuff going on with my shoulder and my wrist that has now
Mhm.
gone away, which like blew my mind. I mean, I had a ganglion cyst in my wrist, and that like prevented me from doing a lot of like push-up type stuff where I had to be an extension. And I
Mhm.
popped it with my iPhone, uh,
Attaboy.
which really worked like in the short term. And then it came back a couple times. I popped it again and again. But what I realized was that like when I was bending forward, I couldn't move my if I was trying to bend forward with with my lumbar spine going into any sort of flexion, it's like my lats, the neural connection from my brain to my lats was so ingrained that I couldn't let my scapula glide around. Like if I was bending forward and reaching in an awkward direction, it was like locked the scapula.
Yeah, so that would be a really good example where you have the lats are contributing to the extension. And if you tighten up the lats, you're going to lose the opposite end of the mobility. So if the lats do adduction, internal rotation, and extension of the shoulder, and they do retraction and depression of the shoulder blade, if the lats are tight, you're going to lose protraction, elevation of the shoulder blade, and flexion, external rotation, abduction. So when you reach for something, you're like, it's not going there.
Yeah.
And in this case, it's very likely that it's coming from the fact that your lats are being recruited to compensate for a lack of stability in the lumbar spine, and then that the sequela, if you will, the cost of that, the functional cost, is a loss of good shoulder function.
Right. And that was causing like glenohumeral joint issues because that was the joint that was ending up moving. I mean, this is how I think of it. Like that joint was making up for the fact that the lat was stabilizing the lumbar spine, or that it was so tied together in the way that my body was naturally. Anyways,
Yeah.
that really like opened up my eyes to a lot of like how much are we driving people to that kind of dysfunction without realizing it through training that then like nobody's trying to reprogram it because they're especially like when I think about it in the CrossFit world and some of the criticisms and critiques I have of that sort of methodology with my current viewpoint is like being completely focused on like the desired outcome to be maximization of work capacity. It's like, well, where's your time and your space to work on this stuff if you can
Yeah, it gets
still pump
it,
out work capacity while having that dysfunctional way of
well,
doing it?
okay, so since you've got a good background in CrossFit, and I think sagittal plane sports are going to have the best expression of an extension compression stabilizing strategy. So that's going to be your CrossFit, Olympic weightlifting, powerlifting. The best athletes in the world that have the most pronounced cross or extension compression stabilizing strategy are former elite gymnasts that jump ship and become CrossFitters. They're
Mm.
uh, basically elite gymnasts. I guess I don't want to go too far down this rabbit hole, but they start younger than the men. The younger you are, the more fragile the nervous system is. I'll get into neurologically where the extension compression stabilizing strategy kind of starts. But they start earlier, the women, and so then they're more likely to sort of have to compensate and the ECSS, to keep it simple there, is going to be maybe the most powerful and pervasive compensatory stabilizing strategy in the weight room. And then the other thing is they don't have to do a lot of hollow body work. So they can, but the men, they have to train in, hold, and perform in a hollow body. And if you remember the hollow body, that's full retroversion of the pelvis, full flexion of the lumbar spine. Well,
Yeah.
that's the opposite position of an extension compression stabilizing strategy. So I don't actually see it that common in the men, despite the fact that they do a lot more strength holds than the women,
Mhm.
because they actually get a decent amount of time in the opposite position, which is going to sort of neurologically not necessarily inhibit the pattern, but it will reduce the likelihood that that pattern becomes pathological.
Right.
Okay.
Like you have, like, there's already other patterns that you train enough that your body sort of has a range to choose from
Be
something.
even dumber from that. You're just not overtraining this one pattern.
Okay.
So if you're think about CrossFit in all day long is bilateral hip hinging for the most part, right? Under varying time domains and varying amounts of metabolic and anaerobic load or aerobic load, and they're just going to go in there and they're just hip hinging all day long. Well, if you're only ever using extension compression stabilizing strategy and you're never doing the opposite, which I know that they do some of that, but it's not proportionate.
Yeah, right.
You're just never breaking the pattern. So you're just greasing the groove of an extension compression stabilizing strategy all day long, and you're never breaking out of it. So I don't even think we need to get as complex as, oh, you're exposing the brain to more variability and more stabilizing options. It's just you're doing the opposite of what you're doing in your training, and then you're breaking away from that. I think
Mm.
that's kind of why. But let's just take 2 seconds, if you don't mind,
Yeah.
and let's talk about why this is so common. So we know what it is. It's overactivity of the posterior chain, arching the lumbar spine, pulling the pelvis into an anteverted position. Um, and then you're stabilizing with extension and compression. Yay. Why is it so common? The first one is it works. Everybody knows this. And in response to your question that you just said, if the goal is to increase capacity, right? The extension compression stabilizing strategy for sure works. But my line is it produces short-term results with long-term consequences. You used to do CrossFit. You've treated CrossFitters before, and you know as well as I do, they come in and their backs are just completely fucked because they're just overloading that posterior chain. And so the first reason that it's common is it absolutely works. I mean, I'm in Columbus, Ohio. If I go down the street to West Side Barbell, they're using this strategy to good effect for performance, but the cost is damage to their spine over time. So lots of disc injuries, lots of facet stuff that happens, right? So the fact that it works is one thing. It's quick. So you and I are in the gym, you're going after a heavy single in the back squat or the deadlift or a clean. You lose your shoulder position a little bit. So what do I tell you? Arch your back, tighten up, shoulder blades in your back pocket, tighten up your lats, keep your chest up, butt back, chest up, sit back on your heels. There's a million cues that allow you to just crank the back on it's a very simple strategy that is just take one muscle group and crank it on as hard as you can, and you're probably going to get a very quick boost in that performance right there. And in the strength training world, both as an athlete training individually and as a coach training one or more athletes, it's very much driven by short-term reward system. So if
Mm.
I'm your coach and I want you to hit that, 405 for the first time and you missed it and you lost your upper back position, and I'm like, "All right, dude, you got this. You got to fucking tighten up, tighten those lats on, drive that chest up, and then you just crank your back on." There's a good chance that you actually get that lift. And if you're a coach or you're that athlete and you really wanted that lift, you just got rewarded for that. So in the short term, looking through the microscope only at what's happening right now, you're like, oh, that worked. When I cranked my back on, I lifted more weights. I need to do more of that. Well, that's cool until it doesn't work anymore. And by that point, you've got chronic low back pain. It takes you 45 minutes to warm up. You wake up every morning and your back is stiff and tight. Then it starts just turning into discogenic stuff and hip things and chronic hamstring pulls and Achilles issues and all that kind of stuff. All from that one strategy that worked, right? So it works. It produces short-term results. The other one is if you're sort of like looking around, like on social media, like a lot of great athletes are doing this. So then you can see because it works, again, because of the short term that how or not short term, how easy and simple the strategy is to be effective. You see it a lot. So now if you're looking around the room and you're looking, look around the universe or the training hall and you're like, fuck, all these guys are doing this. I
Yeah.
should probably do that. So all of those, though, I think come down to the fact that the posterior chain has a neurological propensity for hyperactivity. Okay. We know this in DNS. We teach this in DNS because that open scissor posture, lower cross syndrome, that is a sign of instability that we look for in DNS. We also know this in research with people that have low back pain. They're like their back cranks on. So in an effort to protect the disc, the spine sort of cranks on the back to sort of prevent or motion or splint the spine, so to speak. Cool. So for a lot of reasons, one of them, big word, ontogenetically, in terms of when that we're developing from an immature little baby all the way to an adult with a mature nervous system. So that process is called ontogenesis. Ontogenetically, the posterior chain tends to be hyperactive or has a tendency towards hyperactivity. But then, also when you're thinking about it from a nociception like side, if there's any pain in the system there, neurologically, your brain is just sort of cranking that on as an evolutionary protective strategy, right? So
Almost like
that
a
would be,
reflex.
yeah, kind of. That's another big word. That would be phylogenetically. So as we've gone through and we've evolved as a species, we've learned that if you crank your back on, you're going to sort of protect the spine, you're going to avoid spinal injury, and then you can sort of last longer, right? So because of the neurological propensity for overactivity and because of its simplicity in how the strategy actually works, in terms of the simplicity of executing the strategy, coaches and athletes are able to use it to good effect, and then they're rewarded for that in the short term. The problem is there are long-term costs. The costs are, facet injuries, disc injuries, all other kinds of things that we can dive into if you want, but those have a latent presentation. So it's not like you just do that and you're like, wow, coach, that was cool. I got 405, but now my back's fucking killing me. You're like, that was cool. I got 405. You keep using that strategy. Soon enough, you're hitting 455, 485. You're like, coach, I got 490. I got fucking five wheels. Like, look at me. And then you keep going, and a year or two later, you're like, God, my back is always fucking hurting me. And every morning I get up, it takes me an hour to loosen it up. Or, man, if I stand for too long, my back is tight. Or, God, my hamstrings, I just keep pulling my right hamstring. So, because it takes months, if not years, for this to like really lay roots and become pathological, you just can't see it happening. It's like boiling the frog, right? You just don't know it's happening.
Or
And
that
so
that's
that's
even the cause, right? Like if the negative
right.
feedback loop is so long, the coach never knows. And then you, as
Yep.
the athlete or the person, unless you are
The only
very, uh-huh.
Well, the only way that I was able to sort of figure this out was again just by the good fortune of being taught by Pavel Kolaj and what we learned in DNS. So maybe we don't dive into it right now, but we have to talk about the optimal stabilizing strategy.
Yeah.
And when you know what optimal is, and then again, we just teach that extension compression stabilizing strategy as a sign of instability. So then once I started seeing this, I'm of course, or used to be a shining example of this. And again, that's why I had the chronic low back pain. And, I would do, let me think of any, like Diane, like the old CrossFit workout, and my back would just hurt for days, like
Yeah.
multiple days from doing movements that weren't really that bad. Riding by on a fast horse, if you're just looking at my spine angle, my shoulder position, my foot loading, I look fine. But inside there, if you take a closer look at what I'm doing, my back is cranked on. And I know now what I was doing is I was just over compressing my spine and then just produced a ton of disc injuries in there and all kinds of fun stuff. But again, it was the result of a once effective stabilizing strategy that got me to finish my career as a track athlete. So it worked. But then I had to learn DNS and go, oh, wow, if they're saying that's wrong, well, shit, I did that for 15 years as a track athlete. I mean, I remember injuring my back and sitting in the training hall, and I'm trying to do RDLs, and I realized that if I could crank my back on and just arch the shit out of my back, I could do the RDLs with no back pain. So what is that telling me? In the short term, it's saying do that.
Right. That's the way I'm supposed to do it, I guess.
Yeah. And so you have to either learn from someone like a Pavel Kolaj or what we're trying to teach in the DNS strength training classes and see, oh, this is actually a pathological stabilizing strategy, and we should be stabilizing like this. Then you can start looking for that and identifying it and addressing it in the gym. And then you can start seeing like, oh shit, they're actually moving better weight and they're not warming up as long, and they're feeling better, in the morning, and they can train harder. They can handle a higher, training volume, all with less pain when they stabilize the way that, we probably should dig into here in a second.
Yeah. So yeah, like how do you I don't think people are going to stop training that way necessarily. And like, I mean, I still do a lot of those similar, some of those lifts, but kind of like in different proportions and volumes relative to each other. Like, do you think it's as simple as just adding in, like you said, with the male gymnasts, like they just do a lot of hollow body work. They're in that posteriorly um, tilted pelvic position with their arms overhead, which like,
Super
if you're
long
gonna
lats there.
right, exactly. So the lats are now in a lengthened position with the pelvis held posteriorly tilted. So like you're breaking any sort of like lat extension stabilization by positioning that way. Like, do you think it's as simple as just adding something like that in, or do you think there needs to be like more of a conscious retraining how you're doing the lifts where you are going into that like
So
ECS?
there's
Or
three ways that you can address it, and depending on when you sort of pick it up, you may only need one of them or you may need all three of them. In a perfect world, you're addressing the three ways. The three ways are this: stabilize correctly in your actual movements, make better choices with the exercises that you select, and do, what PRI calls neurological resets to make sure that you're shutting off the ECSS after a heavy leg day. Okay. Those are the three ways you can tackle it. I no longer do any of the shit that I'm going to talk about here because I meticulously try to learn to stabilize really, really well with no back, without overactivity in my back, and I don't want to lose it into extension. And what's, I don't know, like right now I'm literally on the path of training to do a workout called Sinister, but it's 100 single arm swings with a 106-pound kettlebell. We already did that. I'm trying to train to do it with a 60-kilo kettlebell because 60 kilos is just a really cool mark if you're an Olympic weightlifter. And I don't when I'm done training, like today I did 100 swings with a 124-pound kettlebell, and at no point was my back 56 kilos. At no point was my back tight. Not even once. And I got done an hour ago. My back's totally normal. I'm anticipating I'll wake up tomorrow morning with no back tightness. I literally for 15 years, if I got out of bed in the morning, it would take me 2 hours to warm up. And if a fire alarm went off, I would have just told my wife to just get the dogs and get out, and I'll try to get out on my own because I couldn't move fast.
Yeah.
Couldn't do it. So the in a perfect world, and essentially where you're trying to get is at a place where you can use the proper stabilizing strategy in the movements that you're training. Okay. So
Uh-huh.
clean snatches, running, throwing a baseball, whatever, it doesn't matter. And the more sagittal plane you are, and the less degrees of freedom you have in the movements. So, for those of you, just to define that term, degrees of freedoms is essentially options your body has to move. So if you're doing a single arm dumbbell press, you've got a lot of degrees of freedom. You can like twist your forearm, you can straighten your elbow, you can bend your elbow, you can move your shoulder, you can spin around your spine, you can twist and everything. If you're holding a barbell now, and now you've got two hands, now you've restricted your degrees of freedom. So now the body can't move around and compensate in the sagittal and in the coronal and the transverse plane. Everything gets driven into the sagittal plane. So the more sagittal plane the movement is, and the less degrees of freedom you have with that movement, the more likely you're going to perpetuate that extension, compression, stabilizing strategy. Okay, so that's the first one. You want to stabilize well in the movements you're doing. The second one is that you want to make better choices with the exercise that you're doing. So if you're doing tons of bilateral hip hinging, holding a barbell, classic CrossFit. So you go to the gym, and today we're gonna do our strength piece is gonna be cleans. We're gonna do work up to a heavy set of 3, and then we're gonna take a break, and then we're gonna do 50 deadlifts at 225 as a buy-in, and then you're gonna do cleans and toes to bar, 3 cleans, 3 toes to bar, going ascending. Cool. That's just like sagittal plane all day long. So you need to make better choices. So then in that case, you might do a single arm kettlebell swing instead of a clean, or you might do oblique cross toes to bar where you're taking one leg and reaching across just to get out of the sagittal plane a little bit. So you can make modifications that will help you train in a way that doesn't perpetuate the ECSS. And the way you do that is you get out of the sagittal plane and you open up the degrees of freedom. So if you have a movement where there's more degrees of freedom, you're less likely to perpetuate the extension, compression, stabilizing strategy. If you have a movement that is less locked in the sagittal plane, then you're less likely to produce that. A good example would be like going from deadlifts. Let's say that you're going to do 50 deadlifts as a buy-in at 95 pounds, just 135, 95, just plow through it. Well, if I switched over and I did single arm kettlebell swings instead, which is the most underutilized movement in all of CrossFit, well, now I'm still getting a hinging piece in there. That's still obviously sagittal plane, but because I'm only holding the bell with one hand, and now I've increased my degrees of freedom and I've unlocked my torso from the sagittal plane and exposed it to coronal and transverse plane forces. And so now I'm not as likely to overuse my posterior chain because it just can't handle the torsion and the torque going through the body. I need my obliques. I need all of these other muscles to activate asymmetrically. So just cranking my back into extension doesn't work because the ECSS is a sagittal plane compensatory stabilizing strategy. So it works best in sagittal sports. The moment I'm holding a single arm kettlebell, or let's say I'm doing, this wouldn't be a good metabolic workout, but let's say I get in there and I'm doing rope climbs and lateral bends with a kettlebell. Well, I'm just not going to crank my back on there because none of that sagittal plane versus, I'm going to do a 400-meter run and then 20 deadlifts for 5 rounds. Okay, you're going to crank your back on with
Yeah.
that one because everything is sagittal plane. So the second piece is make better choices, and the way that you train so that you're not overusing you're overtraining the extension compression stabilized strategy is you get out of the sagittal plane and you open up the degrees of freedom. So the more degrees of freedom you have, the less like you're going to crank on like that. The last piece is the one that you asked about, and that's just using what I love this term, the Postural Restoration Institute calls neural resets. So I tell CrossFitters that have this stuff, I tell them, hey, I want you to accumulate 3 minutes of hollow holds. We'll get into how I mean that because it's an oxymoron. I want to have a pressurized hollow, but get them with that pelvis cranked all the way back, full flexion of the spine. They can be in quadruped. They can be in DNS, what we call bear position, which is like quadruped, but you're on your feet and your hands instead of your knees. They're kind of floating. A really good one, if they're an experienced crosser, is up in a matador, like a dip station. They can be cranked into that. If they're just absolute monsters, they can be in an L sit. They can be hanging overhead in a hollow position. They can just be doing a normal plank on the elbows, but in that position, they're in full flexion of the spine, in which the posterior chain has to lengthen maximally. And if you do that, then you can kind of neurologically reset any overactivity that might have occurred during the training. So let's say you're a CrossFitter. Guess what? You have to be able to do bilateral hip hinging. Okay, cool. No big deal. You're going to keep working so that you can actually stabilize in a way that doesn't overuse your posterior chain in training, but that's going to take time. But when you get done with training, let's say that I do a workout and let's say it's just lots of sagittal plane. So I'm just going to do 50, 40, 30, 20, 10 double unders and deadlifts. And I'm only using, let's say I'm using 135. So nothing crazy heavy. That's just a lot of fucking hinging. So at the end there, even though I am stabilizing well, I'm probably am going to turn on my posterior chain a little bit. Cool. So then I just finish the day with some hollow body training where I'm breathing into my back, that pressurized hollow. And by the end, my back should feel very, very loose. It shouldn't feel overactive. And then I can go about my day. So that's the third piece, right? So you have stabilized correctly in the movements you're using in training, make better choices with the exercises that you're using in your training, and do some sort of neurological reset to make sure that if the ECSS turned on during training, you're able to sort of shut it down so you're not using it all the time walking around. Those are the three
Mm.
ways that you would tackle that so that they don't have those issues.
And
The
you
hardest
said,
one being stabilized correctly in the movements, which we can get into. There's a motor learning component of that.
yeah.
So the more complex the movement, the harder it is to do. And then there's also in DNS what we call functional capacity, which is essentially a neurological threshold. When you push too hard, your body will compensate into that extension compression stabilizing strategy. And that's because that pattern is a more primitive stabilizing pattern in terms of development, ontogenesis, in terms of development. And because it's more primitive, it's much more neurologically resilient. So when you get tired and fatigued, the optimal stabilizing strategy, which we still have not yet defined, so I apologize to you guys listening, we'll do it. That optimal stabilizing strategy is much more complex. And so, in times of threat, injury, or whatever, fatigue, your body's just going to shut down and go into that primitive stabilizing strategy, which is the ECSS. And so you have to train your functional capacity so you're able to lift heavier weights, move faster, and do sustained movements without fatiguing and collapsing into that ECSS. That's a
Mm.
whole other kind of training that you have to do.
Yeah. Why don't we define? Well, before we define it, it's interesting that you say that
We'll keep
because
teasing it. We're going to talk about it.
let's
We'll keep referencing it, but we won't
let's
talk
keep
about it until the end.
let's
I'm
keep
kidding.
teasing it. It is
Yeah.
interesting. It's like a finer strategy. I think about like a really smooth NBA basketball player where like at any moment they're not really holding any tension. They can go slow, they can go fast, and it's all smooth and controlled, which takes a way higher degree of skill versus like somebody who just moves fast all the time and you actually like couldn't change directions because you're just like holding it. And it's like there's a finer ability to contract at just the right amount sort of automatically
Mhm.
than pushing really hard and just going into this sort of default survival position. And so something I've noticed in myself when you say this is like this limit of what you're calling it
Capacity.
the functional capacity. It's like I've been kind of, I didn't put that term in my mind, but like feeling like, okay, if I go heavier than this, and I've actually been doing it in lifts that like don't even like, if even just like a bench press or something, like a, let's say if I was
Mhm.
doing like a dumbbell bench, it's like I actually find that my entire shoulder girdle is functioning to press the weight differently if I go above a certain weight, and it
Yep.
feels like I'm doing it the wrong way.
Yeah, so you can feel this force, if you will. There's three thresholds: speed, duration, and force. Okay. So
Okay.
you can feel this stress to the nervous system. So put yourself in a scenario where you're going to hold a plank for 2 minutes, right? Or as long as you can. Everyone that's ever done this, assuming you can keep your hips, shoulders, and ankles in line, by the end of that 2 minutes, you will have tilted your pelvis into anteversion forward. Your back would be cranked on, and you couldn't tilt your pelvis back if you wanted to. Okay.
Right.
Put yourself in a scenario. Let's go just straight bodybuilding. You're doing slightly bent over easy bar Scott curls, right? Reverse curls.
Okay.
Doesn't matter.
Scott
Reverse
curls.
curls.
Okay.
So I'm standing there like this. I'm bent forward. And you'll notice that over time, your back just wants to arch and crank on. And the longer you sit there, the harder you push it, the stronger the urge pulling your back into extension. Okay. Same thing, like if you're going to go back to your old CrossFit days. Let's say that you've got a buy-in and it's 100 kettlebell swings, right? In the beginning, you might be holding this wonderful position with pressure in the belly and the ribs down and neutral spine and all the things that everybody loves. But by the end, you're just sitting back on your heels and just arching your back at the bottom of that because you've gone beyond your functional capacity, in this case for duration, so sustained output,
Mm-hmm.
and you have no choice but your back to crank on, right? The last one is speed. So moving very, very quickly. If you ask the body to move faster than it can manage and maintain this optimal strategy that I promise we'll define here in a second, it's going to result into that compensatory strategy. The best example is a little bit awkward, but as a former CrossFit guy, you'll get it. Um, Urinary incontinence. So when you see women that they're doing CrossFit and they have urinary leakage or like a full blowout, that's like the pelvic floor just completely fails, and then they essentially pee themselves. The movements that everybody complains about are not high force movements. You would
Double
think
unders.
double unders, exactly. Double unders, running, and box jumps. Those are the ones that everybody complains about. None of those are high force movements. You would think
Mm.
that a heavy front squat or squat cleans, squat snatches, thrusters would be the problem, because in the bottom there, their pelvis is in a position where the pelvic outlet, the pelvic floor, is maximally opened up. You can have maximum pressure pushing on the pelvic floor, which you would assume would be the best way to make it fail, but it doesn't. They don't typically have problems with front squatting and cleans. But double unders, they're just hopping in place, and that quick contraction is forcing the body to synchronize and establish proper stabilization very quickly, and then it just can't do it, and it just fatigues, and then boom, they've got their urinary blowout. So that's theoretically, that's I think a good example, because I treat this all the time, but that's a good example of your speed threshold. So you have speed, load, and duration. So a load one would be the one that you're talking about. You're squatting. If you keep squatting, you go up more. You're like, man, I'm going to lose my chest position. My chest is going to pop up. My back's going to crank on. We've all been there. The next one's the duration one. That was the plank analogy, where you're just holding a plank, and by the end of this really, really long hold, your back is cranked on. And then the last one is going to be speed duration. Sorry, not duration, speed threshold, and that's the urinary incontinence. Another one that I know gets a little bit challenging because there's so much research on it, but I think that this is at play with non-contact ACLs as well. So
Mhm.
we'll start digging into this a little bit, but
Mhm.
um, an optimal stabilizing strategy is going to use all of the muscles around the joint in the body to manage the joint's position. When you have that, your brain has maximum control over the joint's position. Okay. When you're born as a newborn, you do not have access to all the muscles in the body. And over the course of development, these muscles activate as you go through. The brain is maturing. A lot of the neural tracts in the spinal cord are myelinating, and the muscles are starting to activate. The baby then has access to more movements and more positions, which then exposes the brain to more afferentation, which then drives the process of the brain maturing. And in a perfect world, about 70% of us at the end of ontogenesis, this development, you have a fully matured, healthy nervous system that is able to properly stabilize and control its joints. Okay.
Mhm.
That's an optimal stabilizing strategy, broadly speaking. We'll get into specifically what we mean in the trunk and here in a second. When you have a breakdown in that process, or what we call decentration, where you're no longer using all of the muscles around a joint to control its positioning, in the case of the hip, so we're going back to the non-contact ACL. In the case of the hip, the pattern would be the glutes, a la Vladimir Yanda, the glutes become inhibited. So you're trying to like land or quickly jump out of a rebound position. The glutes are incapable of firing there because of the speed. The adductors take over and it pulls your knee into a valgus position and adds a little bit more of that bad valgus stress. Now, Q angle, menstrual cycle, previous injury, there's like a million other factors that go into that. But I also think that that is a neurological component of that phenomenon.
Mhm. So why don't let's should we define it?
Sure. So I just broadly defined it in terms of how it works in the whole body, and that's using all of the muscles around a joint to manage its position. Okay. So if
Mhm.
I'm talking about the shoulder, I'm not just using my pecs or just using my lats. I'm using all of them, delts, rotator cuff, anything that's around it, both directly and immediately, is going to be managed. So even your subclavius is going to be used to control the position of your clavicle, to manage your AC joint that will have an influence on the scapular positioning and the pec minor and all that stuff, right? Cool. In the case of the trunk, because I think the extension compression stabilizing strategy is most pronounced in the trunk, an optimal stabilizing strategy maximally leverages intra-abdominal pressure while using minimal activity of the accessory muscles of stabilization. Okay. So I think of it as you have primary muscles of stabilization and accessory muscles. The primary muscles of stabilization are the diaphragm, the abdominal wall, and the pelvic floor. Okay. And those three muscle groups work together to create intra-abdominal pressure, which is the foundation of a healthy, stable spine. In the absence of that, then other muscles have to take over. So if you don't have adequate intra-abdominal pressure, your spinal extensors will crank on to compensate for that, resulting in an extension compression stabilizing strategy. Okay. This optimal stabilizing strategy develops as we go through ontogenesis development. And when you're a newborn, we have diaphragm activity, but the diaphragm has not yet begun to integrate with the abdominal wall, the pelvic floor, to create intra-abdominal pressure. So we don't have IAP there, intra-abdominal pressure. You just have the diaphragm is obviously breathing. By 3 months, you've now gotten enough activity there that they start to work together. And then for the rest of development, all the way until complete verticalization that happens between 15 and 18 months, where we can stand up and walk, the core continues to get challenged and develop and get stronger and stronger and stronger so that it can control the torso in more and more challenging positions. Laying on your back is a hell of a lot easier to do than standing upright and vertical. So, but we first establish this strategy wherein you're using intra-abdominal pressure as the cornerstone for stabilization of the trunk. And then you just challenge it more and more. Then they can turn from their back to their belly at about 6 months. Then they can actually, get into quadruped and crawl at 8 or 9 months. And they can get into these other positions that we have in DNS, but, getting into a squat and then standing and then walking between furniture first and then in free space second, being standing and then dropping into a squat first and then being able to actually have the motor control, the balance, and the coordination to be able to stop in the middle of the room, squat, pick up a toy, stand back up, and then walk again. That's like full mastery of this process that really is just about sensory motor integration. And it requires development or maturation of the nervous system so that like the cerebellum can actually make a lot of the micro adjustments to posture and maintain that really, really good strategy. Well, that's cool if you're just walking around or you're just in school. But now let's put us back into the gym. So this is a weird thing. Like we haven't evolved to do 100 thrusters, right? That's just not a thing that we're doing. We haven't evolved to run a marathon in under 2 hours. We haven't evolved to throw a baseball, 90 times every 5 days. That's just not a thing that we can do. So this strategy that naturally developed through millions of years of evolution is now suddenly being just violently challenged in sports. And so what we've been doing in the DNS strength training classes is essentially trying to find a way to take this strategy that has been tested over millions of years on what is the best way for the body to move, and then make the athletes capable of using that strategy in whatever environment their sport demands, which is not what we've evolved to do, right? So when you look at a Rich Froning or a Tia Toomey or a Lu Xiaojun or a Jan Železny or whoever, just pick your amazing athletes. We're all not built like that. And so when you put people, normal humans, in an environment that especially like CrossFit, you're challenging speed, load, and duration, depending on the workout that you're doing. And you're really, really, really stressing that nervous system, perpetuating that potentially the likelihood that they go into that compensatory strategy, which we call decentration in DNS, or in the case of the same conversation, is that extension, compression, stabilizing strategy. So you need to know what that optimal stabilizing strategy is so that you can be cueing it properly in the movements that the athlete's using in their training. You need to be making better choices in the exercises that they're actually using in their training. And then you need to know how to shut off that compensatory strategy so that they can actually use the optimal stabilizing strategy in their everyday life and in their sport. It may take longer to master in the beginning. Remember, the ECSS is a very simple strategy that produces short-term results with long-term consequences. The optimal stabilizing strategy works better in the long term, but takes way more practice. So there's a little bit of a lack of patience in the coach and the athlete to actually work through and do that. Why would you go through and do this? Because, and we haven't talked about this yet, but this is the why behind all this stuff. The extension compression stabilizing strategy is what I call a passive loading strategy. The brain is intentionally loading the passive tissues to achieve stiffness in the spine, the discs and the facets. Over time, you're going to wear out and beat up those passive tissues, resulting in eventually permanent deformation of your passive tissues, which is going to result in permanent compromise in those joints or those tissues' ability to perform. With an optimal stabilizing strategy, that uses what I call an active loading strategy, wherein you're loading the active tissues in the process, minimizing the stress on the passive tissues, discs and the facets to just keep it to the lumbar spine. So if you do the work, you make the right decisions in your exercises, you're practicing your bracing strategy, you're doing your threshold training, then your passive tissues will last longer. And now you will have better quality of life after your sport, whenever you retire. You will be able to handle higher levels of training because you're not going to get injured as often. You won't have to modify your training as much, allowing you to stay the course, do the work that you need to do, all resulting in longer career, more consistent training, less days off, so that you actually can train longer to achieve that maximum performance in whatever it is that you're trying to do, right?
So
That's the
when you,
why.
I think that's a very important why. You know, like I think about like if I were to play devil's advocate as a CrossFit
Bring it.
person, just because I think it gives an interesting point of view is like you could make the argument that because I think like people talk about how we don't really study health, we study disease, like to even for the average person or even the average clinician to be like, how would you know if somebody's getting healthier? Like we know what it looks like to be sick, we know what it looks like to have an injury, but if somebody's getting healthier, what is that? How do you even know that? And I think in terms of like the physical movement of the human body, it's like work capacity and also um, the range of shapes and positions and complexity of tasks you could do. So like I could say that I'm getting physically healthier when my work capacity is going up or as I'm able to do more unique and different functions.
That's one way you could think about it. You could also think about it in terms of the healthier you are, the less pain you're experiencing doing those things that you're describing, the less time you need to warm up, the better your sleep, the higher the training volume you can handle without consequences, the better your sex drive, the better your focus. There's a lot of things that are going to be outside soft indicators that the body is healthy and doing well.
Yeah.
Whereas you could have a scenario, and you've seen dozens, if not hundreds, of these people that, by your definition, are very healthy and high functioning, but their cortisol levels suck. They can't focus. Their sleep sucks. It takes them an hour and a half to warm up.
Right.
They're constantly walking around with some sort of pain, but because they're so driven, they can train through it. I would know that someone is doing a better job of stabilizing well. So I'm going to, instead of answering the broad health question, I'm going to say
Right.
moving better, as I just defined earlier. Those athletes are going to come in and they're going to go, yeah, my back doesn't bug me in the morning anymore. Or that was weird. I don't need 3 hours to warm up. I don't have to get on the assault bike for 10 minutes and then do 20 minutes of foam rolling and stretching and just really take my time. I can just kind of come in, warm up a little bit, a reasonable amount, 5 to 15 minutes, and I'm ready to go. Those are going to be really, really good indicators. Another one that's a little bit more in line with what you're describing in terms of movement quality is the higher the athlete is performing from a stabilizing strategy, the more smooth and controlled and effortless their movements look. So if it looks like you mentioned it earlier, talking about, the basketball player like a Steph Curry or Michael Jordan, like they just make it look so easy. Well, the higher functioning athletes can not only do what you're describing, higher work capacity, more complex movements, but they can do it with less effort. And if you water everything that I
Right.
was talking to down, it comes down to movement efficiency. And when you're talking about internal forces going through the body, the extension, compression, stabilizing strategy is an effective strategy. It is not an efficient strategy. Whereas the optimal stabilizing strategy is going to be more efficient. So the more efficient a movement is, the less muscular effort, the less internal forces are required to execute a specific output. So let's just stick at 60 kilos. If I'm going to do a clean at 60 kilos and I need 1,000 units of effort to do it in my spine to stabilize my spine correctly, that's however many newtons of force going through the spine internally, loading those passive tissues. If I move more efficiently, let's say I use the optimal stabilizing strategy and now I'm bracing really, really well. I'm keeping the spine out of that, end range where I'm smashing the passive tissues. And now the effort goes down to 600 units instead of 1,000. And I'm still able to execute, the 60 kilo clean. So now that's a lot less internal forces going through the body slowly over time, stressing and straining and eventually distorting and damaging the passive tissues. So the smoothness, the efficiency, the effortlessness of the movement is going to be qualitative ways to indicate that someone is healthier, but
Mm-hmm.
then also HRV, recovery, all the other stuff that we were mentioning before. Those are all other indicators that the body's happier and functioning better.
Yeah. So one of the things I was going to mention with this devil's advocate CrossFit thing is like, because I've thought about this a lot, like, is trying to maximize work capacity, misguided when we think about like the longer term implications of what you might be sacrificing to do that. And I think that kind of what I'm saying about this health thing is we should think about people's work capacity over their lifetime, not just like this short term work. Cause like if you think about like my physical health and fitness, one component of that is my physical ability to do work over a long period of time versus just how much can I do during this event that happens once a year. It's like in order to maximize that, you would have to be not compromising the health of your passive tissues to achieve that sort of over time aspect. And I think that that's one of the things that, like throwing in that as like a statement in that, as like a clause in that statement of how to think about that is like, if you think about, I do want to increase my work capacity, but I want to make sure that that lasts, then I can't be using these short term stabilization strategies that might be causing issues that I will not see for 5 or 10 years.
Well, so what you're basically laying out here is the difference between, training for sport and training for life, or if you want to define another way, exercising and training. So if you're training for life and your goal is to live, basically take your health span, the amount of time that you're up and moving around and healthy, and have that overlap your lifespan, the amount of time that your ticker's going as close as possible, then definitely training with that optimal stabilizing strategy is going to be the way to go. I would also argue, though, that if you really want to achieve maximum performance in something and you're willing to put in the years, perhaps decades required to do that, then you're going to be best served by actually trying to train the optimal stabilizing strategy. Because remember, an extension compression stabilizing strategy produces short-term results with long-term consequences. So if you came to me, if you said, hey, dude, I need to get, I want this person to have a 600-pound back squat and I've only got 3 months to do it, I would train the fuck out of their posterior chain. Just crank that shit on RDLs, good mornings, reverse hypers, everything I could do because I only have 6 months and I could give a fuck on what happens afterwards. That's never a scenario I'm going to fall into as a physician. But if you just said, all right, we're doing this, then I would definitely do the extension compression stabilizing strategy. But if you take another scenario, you're like, okay, Ryan, or like you're like, Rich, I want to be able to get to the CrossFit games, or I want to be able to do this thing in Olympic weightlifting, you're going to be better served as long as you're willing to take the time to do it, where we are training you to stabilize in a way that maximally preserves the passive tissues of the body, that minimally loads the tissues of the body, that has you move with a maximum efficiency, meaning input ratio of input to output, and then over time work on your functional capacity, or your capacity to move well. And then once you have that, you're building both of them at the same time. So CrossFit just says capacity, and they're just basing it on basically like workout density. And there's no real consideration for movement quality, certainly not, well, what I'm talking about. Um, but if you trained the optimal stabilizing strategy so that you're able to execute the work capacity that you're describing, but with the proper stabilizing strategy, well, now let's go back to what I said a couple minutes ago. You're going to have less moments in your training where you have to modify the exercises. Like you're not going to have the 6 weeks you're like, oh, I can't do back squats now, I'm going to do front squats instead. Okay, well, that's deviating from the plan. So that's not optimal. You're also going to have less periods where you just have to sit out. Like, oh yeah, sorry, I can't. I just got to I got to take a month off. I'm going to rehab it. I'm just going to work on my aerobic capacity. I'm just going to do some rowing and some assault bike, some strict work because I can't hinge anymore because I fucked my back up. So you'll have less of those. You can also handle higher volumes, higher intensity, or what I call training load, which is volume times intensity divided by time. So whether you want high workout density, you want high intensity or high volume, you factor all those together, the more efficiently you're moving, the higher that number can be safely. Okay. So less modifications, less sitting out, right? Higher training intensity or training load. And then also you have more time to train the body. Time is what it actually needs. So like if you want to go to the CrossFit games and you want to do what Rich Froning's doing and just be an elite CrossFitter for 15 fucking years, you better move well. And the dude does move well. Tia Toomey came back from, popping a kid out for Christ's sake, and then turns around and wins the CrossFit games. It's amazing. No one is doing that. Like that's incredible. So the more efficiently you move, you do gain a benefit as an athlete. It just takes longer to reap those benefits. But at the end of the day, you can only train as hard as you can train. And if we can keep you healthier, you might have to train for another couple years to eclipse what you would have gotten with the ECSS, but then the ceiling moves up on you and you can get closer to maximum physical expression in something like squatting heavy or running or CrossFit or whatever. That if you're using a less efficient strategy, you're going to, number one, just from a biomechanic standpoint, if you're moving less efficiently, your muscles can only contract and produce so much force. And if you need to be able to squat 700 pounds and you're losing 30% of your force due to inefficiencies in your movement strategy, you're just not going to do it. But the other one, and the main one that I think ends people's careers, is they get hurt, they get injured. So like they fuck their back up and then they just go, I can't do this anymore. So if you really want to get to your genetic limit, that is going to take you at least a decade. No one is hitting their actual, structural genetic limit in a sport training for less than a decade. It doesn't happen. It takes years and years and years consistently and repetitively training the body in an environment, the adaptation to which is the desired adaptation. I want to get stronger. I want bigger muscles. I want to be faster, whatever it is. Decade, a minimum a decade. I think if I remember back to my throwing days, which was a while ago, I think they said 12 to 14 years is what it takes for someone to fully achieve mastery in a movement. And for me, it was the hammer throw. And that's what the Soviets thought at the time. Don't quote me on that because I'm not. That's pulling from an old file in my brain I haven't accessed in a while. But that answers your question though, where you were playing devil's advocate, and you're like, well, if I'm a CrossFitter and I want to do this and I want to work on capacity, you can work on capacity with a shitty strategy and get your short-term results, but then deal with the chronic low back pain and the injuries and that shit. Or you can work on it with a good strategy where you're not going to beat your body up as much and maybe over longer period of time. So let's say one of them is a 3-year period, another one is a 5-year period. But at the end of that 5-year period, I'm healthier, happier. The quality of life when I retire from the sport is going to be better, and I'm actually able to, have a 5, 10, 15, I don't know what, but higher work capacity because I was capable of getting better quality, more consistent training in for a longer period of time, which allowed my body the essential time it needed to neurologically and structurally adapt to the training so that I can actually train that way without getting hurt.
And so would somebody do that? Like, I mean, I think you said that like the gold standard or the ideal is that you just do your training that way.
The better
And
you get at it, yes, the more you're able to utilize the optimal strategy in the sport itself.
and so in sort of training that, like, would that be like, because you said the three different ways of training it, of working on it, right? Like you do it in the lift, you do a specific,
You
I
make
forget,
better choices with the exercises.
make better choices with the exercises, and then you do some other thing that like drives the neural tone in another direction to avoid then
Think of
having
it,
the
Ryan. Think of it as reciprocal inhibition.
reciprocal
That's
inhibition.
all you're all you just I'm just gonna crank on my abs,
Yeah.
pressurize my belly, and then just put my spine in a position where I have to relax my extensors.
Yeah.
And that's just gonna turn down the gain, the
Uh-huh.
neurological gain on the posterior chain there. And then that'll allow the back just to kind of calm down. So you're less likely to just be walking around with it cranked on. But the more so when I first started going down this rabbit hole, I don't know, 6 or 7 years ago, I would finish every training session with 3 to 5 minutes of hollow body training. I do zero of it now, right?
Okay, got
I
it.
just don't do
Interesting.
it anymore because I don't even do core work anymore. Because if I'm doing kettlebell swings or squats, I I know how to stabilize, and I'm basically always working on my bracing strategy, regardless of what I'm doing. I could be doing, you know, I mean, certainly lower body stuff more, but if I'm doing a strict press of the kettlebell, fine. I'm able to stabilize in a way that's going to encourage, train the optimal strategy. I also make better choices for my back and that kind of stuff. So I'm not I'm not saying that if you stabilize like this, then you can train any way you want without any consequences. If I went back to 5 days a week of Olympic weightlifting and squatting and hinging like I did when I was a track athlete in my 20s,
Uh-huh.
my back would be bothering me. It would probably be bothering me less than it would be had I been using that extension compression stabilizing strategy. But choosing the right exercises is critical, and that becomes more challenging depending on the sport that you're in. So I'll play devil's advocate
Yeah.
for you. Um I'm a huge kettlebell guy, but like I'm not gonna tell, Matty Rogers or Lou Xiaojun that if you just started doing kettlebell training 3 days a week and only use the barbell once a day, that you would be an Olympic, you would still snatch double body weight. Get the fuck out of here. So the option to get away from the barbell is not as available to a Matty Rogers or a Lou Xiaojun, a competitive Olympic weightlifter, as it might be for you or I, that we're just kind of recreational fitnessers that are trying to last as long as we can. So this is the fun part of taking the square peg and fitting it in a round hole. You have to look at what are the demands of the sport, and then this is the art of I think of strength training as an art and science.
Yeah.
The art of it is knowing, like, okay, well, how much can I get them out of the sagittal plane? How much can I modify these exercises in a way so that I can train the body to move the way that we need to maximize the performance and the longevity for this athlete? But if I'm training a golfer, low force output, high speed, lots of rest, completely out of the sagittal plane. They don't have to squat or deadlift. I could have them doing, you know, a la Gray Cook, Greg Rose, rotational, great, good, cool movements. They don't need to be doing bilateral hip hinging. But if I have a CrossFitter that walks in the door and they're like, "Hey man, I've made it to regionals the last 3 years. I got to get to the games." Well, that's a completely different story. I can't tell, of someone that wants to be a world class hip hinger under high metabolic demand. Like, well, all right, man, we're just going to not use any of the barbell. We're going to do this other stuff. You can do that in the off season, sure, right? Cool. But when you come in to the actual season, the 3 or 4 months that you've got to really hone in everything, and you got to just learn to push as you've done before. You just got to learn how to embrace the suck or whatever. Those athletes need to be doing bilateral hip hinging, and so they're not going to be able to use all three of those as well. But then again, well, maybe instead of doing American swings, you're doing single arm snatches. It's close, right? So there's a lot of not nuance, but there's a lot of gray area and fudging that you can do to
Like
make better
knobs,
choices.
like
Yeah,
knobs
but
you could
without
turn.
compromising the performance. And then the
Uh-huh.
last one, so in that case, so let's say that they're stabilizing incredibly well and they brace really, really well, but they're still doing a ton of CrossFit stuff. Okay. And they're coming into the season where like they can't do any of this bullshit rehabby stuff where they're doing 6 or 8 exercises in a workout and they're only using a little bit of barbell stuff. They need to be able to grind and just go. Well, then that's when you have to dial up the hollow body training after their
Mm.
workout so that they're able to minimize, any sort of overactivity of the posterior chain that's going to naturally happen when they do the training that they're doing.
Got it. And when you're training somebody to build up this like functional capacity and like the awareness of it in those three different variables of, you said speed, duration, and load, I
Load.
think it was. Like, are you approaching that in specific exercises or in the exercise that they want to include in their training? It's like, is there any sort of consideration of using it that way, or is it more like, okay, I'm doing jumps, so I need to like be aware that I'm doing this fast. You know
So
what I
there's
mean?
a it's broadly speaking, what you're doing is you need to make the athlete aware of what the optimal strategy feels like and what it feels like when they start to compensate. Okay.
Okay.
The threshold training that I described earlier, you're going to mainly do with your primary lifts. I'm not doing threshold training with biceps curls, right? I'm focusing more like I might do threshold training on barbell push press. I might do it
Well,
on
when you say threshold training, you're talking about when you're pushing the functional capacity, or what do you mean when you say
yes.
threshold training?
So
Okay.
yeah, so if you're going to do functional capacity or functional threshold training, you're essentially going up to the level where if you were to go any harder, any longer, any faster, or any heavier, you're going to compensate. You described this
Yeah.
feeling when we were talking about this, where you're like, man, if I go a little bit heavier, I'm going to feel my chest come up, right?
Right. Yeah.
So in those cases, you're going to find that just below that threshold, and you're just going to do repeated exposure to that threshold to give the nervous system time to learn to develop and become more resilient so that you can use that pattern at heavier and heavier weights or for longer and longer times. An example might be I had a CrossFitter a couple years ago, and her complaint was low back pain when she would do more than 20 kettlebell swings. Okay. And so basically we went in, this particular athlete just had god awful body awareness. So she couldn't feel when tightness came on. So I just
Mm.
waited until it was painful. So I said, okay, just go out and just do some swings. How many can you get? And tell me when the pain presents. So then we took that, we found that I cut her way down, and I basically was just having her doing EMOMs instead of, I think her pain came on at like 27. So I was having her do EMOMs at 9 and just repeatedly trying to do that. And then I just kept working it up more and more and more and more and more. The reason it went down to 9, by the way, is if by the time pain presents, she's well beyond her threshold. So if she could actually feel, or I identified when she hit her threshold, it was probably much closer to 12 or 13 than it was 27. So I got a little bit too far in the weeds there. So there's three barriers that you can use. One of them is the actual threshold itself. The next one is going to be tightness, and the last one is going to be pain. The threshold itself, let's say that she lost her threshold at 26. I could have had her doing repeat effort at 24 reps.
And that's coming from you visually seeing it
Or
and
yes,
or her
her
knowing, oh,
feeling
I'm
it.
doing it. I'm doing that
So
thing.
let's stick with the back.
Yeah.
The things that you'll feel, the first one is that you lose pressure in your pelvis. The second one that you typically feel is your abdominal wall will suck in instead of being pushed out. The third one, and then now that we're no longer going in order, but you'll feel your chest pop up. You'll feel your abs, tense. You'll feel your back crank on. You'll feel your pelvis tilt forward. You'll feel your body shift to the heels and roll to the outside of your feet. You feel your shoulder elevate. These are all signs that you're essentially decentrating and you're losing that optimal stabilizing strategy. So when the patient or the athlete is aware of that, they can be trying to find that in their training. And when they are doing their repeated effort work, the moment that they can no longer maintain, I think intrapelvic pressure is the best one. It's the most sensitive one. The moment that they can't maintain intrapelvic pressure, well, then they're done. I shut them down because now we fatigue that pattern and then we'll come back another day. To answer the question that's probably bouncing around in your head, well, how often would you do it? Depends on the athlete. So many years ago, I worked with Christy Ermo, who's this amazing athlete that has unbelievably good body awareness, unbelievably good movement qualities. So for her, I wasn't her coach, but I never suggested that she do any threshold training because she moves beautifully, even in the middle of a CrossFit Games workout. So she needs near zero of them. But then I have, an athlete that comes in that is constantly blowing her back up and she can brace well in the, in the treatment room. We can do some rehabby stuff. It's great, but you put this chick under any load or any metabolic stress and she suddenly just her back cranks on and she's fucked. That athlete needs to be doing more functional capacity work. And obviously, the exact dose on that is the art of what we do. But you're going to do more of the threshold work in the off season as they work, into the competitive season. You may choose to keep it in there. You may drop it out, whatever the case may be. But that's like specific threshold training. To answer the question that you originally said, like, well, how are you doing this with the training? Really what you're doing, and I do this in all of my training, I'm familiar with what it feels like to use the right strategy. Okay. And because of that, now in everything that I do, whether it's, I'm trying to get a 50% body weight pull up, which I suck at pull up. So it's taking a long time. I'm trying to make sure that I'm using the right strategy in every rep that I'm doing with my pull ups. And the moment, like if I'm doing a pull up and I get here and I lose my shoulder blade into elevation and protraction, well, I've lost serratus and lower trap. I'm done. Or actually, I'm sorry, we haven't been talking about the shoulder, so I'll go back to the spine. If I'm doing like a lot of times right now, I'm trying to really work on my hip hinging. Well, I don't want to fuck my back up anymore. So let's say that I get done, I get 100 swings with a single arm swings with a really heavy kettlebell, but I want to still work on work capacity. Well, my grip is fried. My trunk is fucking wrecked because it's been doing single arm stuff with like a 56 kilo bell, whatever. Then I might do a CrossFit style workout where I'm doing, 5 rounds of 20 swings and 40 double unders to still be doing swings with a light metabolic demand, but now I'm doing swings with the next bell heavier, so a 60 kilo bell, but with two hands, right? So I'm in there doing that. Well, if I'm 3 rounds into that and my back starts to crank on, I'm done. The bell goes down and I'm done. I'm 47 years old. I don't have any time to blow my back out. But because I'm, a recreational athlete, as opposed to a professional athlete that gets paid to do what they're doing, I shut it down every time I can't stabilize correctly. Immediately, I'm done. I'll switch on to something else. I'll hop on the stationary bike. I'll do some, zone two shit, but I'm done pushing my body because I do not want to fuck my back up.
Yeah, and like I think a lot of this, what you're talking about, comes from a lot of training experience to have that awareness of
It
knowing
does.
what it feels like. And that's probably
That's the
also the
best
reason.
criticism for it. Is it, the biggest criticism for it is that it requires a lot of body awareness, it requires a lot of knowledge, and it requires a lot of patience. You learn that patience as you every time you fuck your back up and you're
Yeah.
like, that was dumb. I need to like like right now, I hurt my AC joint a week ago.
Uh-huh.
And I was just about ready to test out of the 52 kilo kettlebell, crushing the workout, ready to go. Like my seventh swing. So it was the last round. So my 117th swing of the work of 120. I felt like this tightness over here. And I was just kind of like, in the middle of the top of the swing. I'm like, okay, should I keep going? I was like, let me see what the next rep is. It was fine. So I finished the last 3 reps, set the bell down. Then I did 15 Turkish get-ups. For whatever reason, the Turkish get-ups felt fine. Well, then later that day, I'm getting the trap. I'm getting like even my
Mm.
platysma was really tight, my scalenes. And so then now I'm going through and I took my time. And every time I went into the gym, I was like, okay, I had Dr. Muse, one of the guys I work with, he treated it, got a lot better, but then, still raising my arm up, moving it around. It wasn't feeling good. 20 years ago, I probably would have just found a way to warm up enough that I could train without pain,
Mm.
and then I would just be slowly fucking it up over time. Well, now, because I've learned, and the consequences are higher when you're 47 than when you're 27, I just waited. And so then yesterday I was able to do get ups, again, just easy. I did, 10 calories on the assault bike, two Turkish get ups with a 48 kilo bell, just nice and easy. And I was happy I got to the 48, but if the 48 was starting to make my shoulder hurt, I would have gone down to, the 40 kilo or the 56 or sorry, the 53, whatever it was. And I was always reading my body as I was going through there. And if I couldn't use the right strategy or I felt like I kept compensating, I just was going to shut it down and I'll get back on the assault bike and I'll do more of that because the consequences of not stabilizing correctly for me are high. And I have no interest, no need, and I have no timeline. No one's paying me to do this. No one gives a shit how fit or not fit I am. It doesn't really matter. So for me, I'm using a short term goal. This might be a great thing to end on. I'm
Uh-huh.
using a short term goal to give myself motivation to stay as fit and as healthy as possible as I go down this long 50, 60, 70-year path to maximizing my health span. So I think that using short-term goals like kettlebell training, marathon, whatever,
Yeah.
can add spice to and motivation to your training for longevity, but you can't always just do everything for longevity. You'll just get bored and you just won't stay with it. And yeah, last you might still last long. I don't think you last longer, but you're not going to be in maximum fitness shape. I want to be as fit and as healthy as possible, and that requires using short-term goals
Mm.
to keep the heat of the engine going. If I just am like, nope, I'm just going to exercise and I'm only going to do stuff that serves, me getting off the toilet when I'm 85 years old, and I'm not going to do anything that compromises it. Okay, cool, but I'm not going to be as functional, as fit, or as healthy as I might be if I use some short-term goals to kind of push. Whether they're short-term or long-term, though, at my point, I'm using that optimal straight stabilizing strategy. And the moment I can't, I shut it down and I do something different.
Yeah, that I like that because otherwise it's like, what are you going to do? Just celebrate longevity like the day before you die? Like, hey, I did it. Okay, bye. Like,
Yeah, and I, I
have
I
some
think
fun
that
along the way.
I don't think that avoidance is not going to serve you as well as pushing your body and making sure that it's high functioning. So what I mean is if you had two scenarios, one person that's maybe trying to do what I'm doing, like, okay, I want to be in as good a shape. I want to be able to still perform maximum contractions. I want to still be able to have good metabolic health. I want to still have a decent amount of muscle mass. I want to have good movement quality, all that kind of stuff. And I'm going to be safe about it. And I'm always going to be, cognizant of how my body's moving to avoid injury as best I can. Versus someone else is just like, no, I'm not going to do anything I'm not squatting. I'm not going to do any lifting. I'm going to do very easy machines just so that I can like keep it moving. But I do not in any case want to hurt myself. At the end of those two people's lifespans, one of those is going to be happier and more fit, higher muscle mass, better VO2 max, better aerobic capacity, all that stuff. The other one, they might not have gotten injured along the way, but they're not going to have the muscle mass. They're not going to have the VO2 max. And those are going to be huge variables in terms of actually lengthening your life.
I think that's a great way to end this.
We got a finished really big picture, but this is awesome, Ryan.
Well, I appreciate you coming back on for another episode.
Always.
For people who want to learn more from you and absorb more of your expertise, you said you just recently finished part 3 of DNS strength
Yeah,
training.
very much of what we talked about today is going to be inseparably influenced by dynamic neuromuscular stabilization, DNS. It's a rehab approach that comes out of the Czech Republic that was created by Pavel Kolaj. Uh, Everything that I was basically describing today, it comes from that. And in taking those classes, which are predominantly rehab classes, I realized that it has, really, really good utility in the strength training world. And so I created a 3 series track called DNS Strength Training, and it's 3 3-day classes. And in each one of those classes, we dig deeper and deeper and deeper into these concepts. We get into the functional capacity training. We get into stabilizing strategy. How do you assess it? How do you correct it with DNS exercises? How do you then train the capacity for those things? And each one of those courses is going to dig farther into those. So the first one is just sagittal plane, entry level explanation of the concepts. Second one, we get out of the sagittal plane and we start introducing unilateral and asymmetrical movements. So now you've got torsional forces going through the body. And then the last one is really about mastery and integration. So we take everything that we learned from the first 2 classes and we kind of put it all together. And the theme that I think about is you want to basically assess, prescribe, and train. So assess the body, know how it's moving, prescribe the right corrective exercise, which is going to be DNS exercise, and then how do you train those patterns? And we that class is really fun. We just did the first one in November at Exos in Scottsdale. Um, that's literally like we had a professional volleyball player come in and we just did a full assessment of her. We talked about like, okay, well, where's the problem? And then here's the problem. Here's the movement quality issues. What are the DNS exercises that we could use to correct that? And then how do you modify and properly program that athlete so that she can actually use those patterns, and back to what we talked about for the last hour and a half, how are you able to actually get her capable of using those patterns in her case, volleyball. So those are probably the best ones. You can go to athlete-enhancement.com. And if you just kind of go to the shop, there's all the courses there. I have other courses that I do on kettlebell training, on core training. Um, the YouTube page, it's just athlete enhancement, and then also Instagram athlete enhancement are probably the best ones.
Awesome. Great. Thanks so much.
Cool. Thanks a lot, Ryan.